Welcome to the Medicare Advantage presentation. Open enrollment is from November 8th through the 24th, 2021 for benefits beginning January 1st, 2022. What's the important news about 2022? The Kelsey-Seybold Physicians Network now accepts Aetna Basic PPO and Aetna Premier ESA PPO. You will pay Aetna plan copayments and deductibles if you go to a Kelsey-Seybold clinic. There are no changes to your monthly contributions for 2022. As a retiree, you are eligible for coverage if you are covered by Medicare Parts A and B, and you are covered by a City of Houston health plan, or you were covered by a City of Houston health plan on January 1st, 2010, and filed paperwork to opt out of a city plan. You may elect to re-enroll or opt back in during this enrollment period. If you have Medicare Parts A and B, you can only opt back into a city-sponsored Medicare plan. To access the Medicare Advantage enrollment form, visit cityofhoustonbenefits.org and go to the Forms and Documents tabs to download a fillable PDF. During the Medicare Advantage Plan open enrollment period, forms must be submitted on or before November 24, 2021 for a January 1, 2022 effective date. To change plans after January 1, 2022, the Benefits Division must receive your form by the 15th of the month for coverage to be effective the first of the following month. Once you have completed your form, there are 3 ways to submit it. You can mail it to the City of Houston Benefits Division, upload it to the Secure Document Submission portal at cityofhoustonbenefits.org, or drop it off in person to 611 Walker. Your 2022 plan options are the Aetna Basic PPO, the Aetna Premier Extended Service Area PPO, and the Kelsey Care Advantage HMO. Contributions for these plans are $18 per person per month for the Aetna Basic PPO, $63 per person per month for the Aetna Premier ESA PPO, and $42 per person per month for the Kelsey Care Advantage HMO. All members will receive new 2022 ID cards. Make sure your address is correct with the City of Houston. Contact us at retireebenefits@houstontx.gov or call 832-393-6000 to correct your address. Allow 7 to 10 business days from the time your enrollment is received to receive your insurance card. Not sure which plan to select? Schedule your telephonic appointment with a Kelsey Care Advantage or Aetna Healthcare representative to determine which plan is right for you. Call Aetna Healthcare at 1-800-307-4830 or Kelsey Care Advantage at 713-442-2264. The Eligibility and Enrollment Support Center is available to assist you with your questions. The City of Houston Benefits Division is available Monday through Friday, 8 a.m. to 5 p.m. Central Standard Time. Aetna Healthcare is available Monday through Friday, 7 a.m. to 8 p.m. Central Standard Time. And Kelsey Care Advantage is open 7 days a week from 8 a.m. to 8 p.m. Central Standard Time. Each plan has unique features and benefits. Let's learn about the Aetna plans. With both Aetna plans, members will have medical and pharmacy benefits combined in one plan. There is no need for a standalone Part D plan. One plan also means one ID card for all of your medical and pharmacy needs, one phone number to call for questions, and one monthly explanation of benefits. Members on the Aetna plans will receive more benefits than original Medicare, and they will have access to our core advocacy and wellness benefits. To be eligible, you have to be enrolled in Parts A and B and pay your Part B premium. You can only be enrolled in one Medicare Advantage plan at a time. With the Aetna PPO plans, you have the freedom to see any licensed doctor or hospital as long as they are eligible to receive Medicare payment and accept your plan. Again, Aetna Medicare Advantage provides coverage nationwide. No referrals are needed, and you have access to in- and out-of-network providers. Our plans also cover you when you are traveling outside the country in case you have an urgent need for medical care. When traveling away from home, Aetna will help you find a doctor that accepts the Aetna Medicare Advantage plan. We encourage everyone to select a primary care physician, but it is not required. Both Aetna plans are national PPO plans. These plans are designed to give you the flexibility to see any provider whether or not they are in network. You should know that many doctors do in fact accept Medicare and accept Aetna Medicare Advantage, but there may be some who don't. You can use out-of-network providers, but they must be eligible to receive Medicare payment and accept your plan. If your providers say they do not accept the Aetna Medicare Advantage plan, we can call them to explain the plan and make sure their staff understand how it works. Many times, this results in the doctor's office understanding how to work with Aetna Medicare Advantage. One of the key differences between our two plans is the ESA. ESA stands for Extended Service Area. On our basic PPO plan, your co-pays or cost share may be higher if your doctor is out of network. On the Premier ESA PPO plan, with the extended service area, you can see providers in and out of network at the same cost or copay. This is a unique feature of the Premier ESA PPO plan. Okay, let's take a look at the plan benefits. Here you'll see a side-by-side comparison of both plans. The basic PPO has a $0 deductible and a $3,400 maximum out-of-pocket for in-network medical care, and a $5,000 combined maximum out-of-pocket for in- and out-of-network medical care. Preventive care is covered at 100%. PCP visits are a $0 copay, and specialists are a flat $15 copay for in-network providers, and 30% for out-of-network providers. Inpatient hospital care is a flat $300 copay per stay, and outpatient surgery is a $150 copay when using in-network providers and 30% for out-of-network providers. ER visits are a $50 copay in and out of network. Most out-of-network services will have a 30% coinsurance. The Premier ESA PPO plan has a $150 deductible and a $3,500 maximum out-of-pocket for medical care. PCP and specialist visits are a $20 copay. Inpatient hospital care is a flat $250 copay per stay, and outpatient surgery is a $0 copay. ER visits have an $80 copay. The Premier plan has an extended service area, so the same cost share or copay will apply whether you are using in or out-of-network providers. Let's discuss your prescription drug benefits. Both the basic and Premier plans include Part D coverage. You do not need a separate Part D plan. Both plans have a preferred network. Members will have access to Aetna's entire network of pharmacies, but if you fill a prescription at a preferred pharmacy, you may pay less. Some of our preferred pharmacies in the Houston area include CVS, H-E-B, Costco, Kroger, and Walmart. The basic plan has a $0 deductible. Tier 1 preferred generics will cost $15 or $10 at a preferred pharmacy. Tier 2 non-preferred generics will cost $20 or $15 at a preferred pharmacy. Tier 3 preferred brand name drugs will cost $35 or $30 at a preferred pharmacy. Tier 4 non-preferred drugs will cost $50 or $45 at a preferred pharmacy. Tier 5 specialty drugs will cost $80 or $75 at a preferred pharmacy. The basic plan includes full gap coverage. If you fall into the coverage gap, aka donut hole, you will continue to have coverage, and these same copays will apply. If you enter the catastrophic phase, you will pay CMS standard rates. We also offer mail order drugs up to a 90-day supply. The Premier plan has a $0 deductible. Tier 1 preferred generics will cost $5 or $2 at a preferred pharmacy. Tier 2 non-preferred generics will cost $20 or $10 at a preferred pharmacy. Tier 3 preferred brand drugs will cost $40 at a standard or preferred pharmacy. Tier 4 non-preferred drugs will cost $75 at a standard or preferred pharmacy. Tier 5 specialty drugs will cost $75 at a standard or preferred pharmacy. The Premier plan also includes full gap coverage. If you fall into the coverage gap, aka donut hole, you will continue to have coverage and these same copays will apply. If you enter the catastrophic phase, you will pay CMS standard rates. The Premier plan offers a discount on mail order drugs. You will pay 2 months copay for a 3-month or 90-day supply. For those who want to focus on wellness, Aetna has programs such as Resources for Living, Healthy Home Visits, and Silver Sneakers. For those who want to prevent health challenges from getting worse, Aetna has programs to help with chronic or complex conditions such as diabetes and heart disease. They also offer on-demand assistance through programs such as telehealth, teledoc, or their 24-hour nurse line. For those who have complex medical conditions, Aetna offers nurse case management, help preventing you from being readmitted to the hospital, and compassionate care for advanced illnesses. These programs are intended to complement your current health care. They aren't meant to replace it. Both plans include routine eye and vision exams, as well as eyewear reimbursement. The basic plan covers eyewear up to $50 every 12 months, and the Premier plan covers $70 every 24 months. The Premier plan also includes a hearing aid reimbursement of $500 every 36 months. A healthy home visit is completely voluntary. If you choose to take part, a nurse will come to your home to review your health needs and will do a home safety assessment. The visit doesn't replace care from your doctors, but Aetna will work with them to help meet your health needs. The nurse focuses on safety in your home, does a medication review, and asks about your medical and family history. Aetna may recommend any of their support programs that may be helpful for you. We'll talk about some examples of these programs next. Aetna will communicate the results of your visit with your primary care doctor. This program is available at no cost to you and will help you take advantage of the benefits available to you. Silver Sneakers is included in both Aetna plans. The popular Silver Sneakers fitness program allows you to access more than 17,000 gyms and fitness centers at no additional cost. Silver Sneakers also provides over 200 on-demand videos and live virtual classes. You will receive a packet in January with more information on how to use this program. We don't want you to worry about how you'll get to and from your medical appointments. That's why Aetna's Premier ESA PPO plan offers optional, non-emergency transportation that gets you there and back. The plan includes 24 one-way trips per year. These rides are included with the Premier ESA PPO plan at no extra cost. The Meal Home Delivery Program provides 14 delicious and highly nutritious meals delivered to your home following your hospital stay. It will cater to special dietary needs, including diabetic and pureed foods. With the Premier ESA PPO plan, this benefit is provided to you at no additional cost. Aetna is here to help with a team ready to answer your questions. Whether you need help comparing your options, finding a doctor, or want to know what your copay will be for a certain prescription, don't hesitate to call. They are available Monday through Friday, 7 a.m. to 8 p.m. Central. The phone number is 1-800-307-4830. Next, we'll go over the benefits of the Kelsey Care Advantage HMO plan. Kelsey Care Advantage is a local Medicare Advantage plan that has been contracted and offered to Medicare-eligible retirees of the City of Houston since 2010. Kelsey Care Advantage has been rated 5 out of 5 stars by Medicare for the past 5 consecutive years. This plan combines all of your Medicare medical and prescription drug plan coverage into one plan. This plan is 100% local to the Houston area, including provider network and member services. It allows you open access to all Kelsey-Seybold clinic locations and providers, and no referrals are needed. This plan includes additional benefits that are not covered by traditional Medicare. For example, virtual health with a Kelsey provider who has access to your personal medical record and prescription medications that you are taking. Here are some of the Kelsey Care Advantage plan highlights. There are no deductibles for medical services or prescription drugs. Copays are low. Prescription drug coverage is included at no additional cost. The plan includes extra benefits not covered by Medicare. The $3,400 out-of-pocket maximum allows you to plan ahead. This is a worst-case scenario. $3,400 is the most you'll pay out of your own pocket for medical expenses in the year. Anything after that is $0. The Kelsey Care Advantage plan premium is $42 a month per person. Some typical copays are $0 for a PCP visit, $25 for a specialist office visit. The inpatient hospital copay is $300. The outpatient hospital copay ranges from $150 to $175. The urgent care copay is $25. Video visits are covered with a $0 copay for PCP and $15 copay for specialists. The copay for an individual mental health session is $20 and $15 for a mental health video visit. You'll pay $10 for Tier 1 prescriptions and $15 for Tier 2 prescriptions. Kelsey Care Advantage not only covers everything covered by traditional Medicare, but also covers extra benefits not covered by Medicare, like free gym membership through Silver Sneakers. You can go to any participating Silver Sneakers gym at no cost. Vision coverage through VSP. Retirees get an annual $50 eyewear allowance. Members get up to 20 free one-way, non-emergency transportation to and from your medical appointments. Access to worldwide emergency coverage and urgent care in the U.S. In addition, you'll have access to Virtual Health and MyKelsey Online, which provides you care anywhere in the world. Communicating with your health provider is easy through MyKelsey Online and the MyChart app for your smartphone. You can email your doctor, schedule appointments, view test results, review immunization records, and more. Kelsey Siebold has been providing Houstonians with care for 70 years. They have 25 locations, 450 providers, over 5,000 affiliate providers, and over 70 medical specialties. There are 6 new locations opening in 2022, with more locations in the future. Kelsey Siebold offers same-day appointments and is your one-stop shop for everything under one roof: doctors, pharmacies, and lab. Stars matter. Kelsey Siebold Advantage is the only plan in Texas to be awarded 5 stars for 5 consecutive years in a row. This award is based on customer experience, managing long-term chronic conditions, keeping members healthy, screenings, tests, and vaccines, handling issues and complaints. For more information about Kelsey Siebold Advantage, call them at 713-442-2COH or 2264, or visit them online at kelseycareadvantage.com/COH. Links to the Medicare Advantage Plan Open Enrollment Decision Guide, enrollment form, plan summaries, and more are located at cityofhoustonbenefits.org. Thank you for attending the Medicare Advantage presentation. We have representatives from the City of Houston Benefits team, Aetna, and Kelsey Care Advantage who are now available to answer your questions.